All right, everyone. Thank you for coming out to the showcase for the graduating class of the 2021 Launch Lane. Welcome, everyone. I am very, very, very happy to see all of you. With the way things have been going with COVID, I wasn't sure if anybody would come out. So it's really nice to see so many faces and so many people supporting this year's graduating class. A little history. Launch Lane has been running in various guises. What we're launching is called Digital Health Accelerator. And it's been going on here since as long as I've been here, which is about 8 years. And it's a program that is designed to take promising startups in the ecosystem and help them commercialize and focus on revenues in addition to investments, but focus primarily on revenues. Because one of the things that we know is if you give a company some money, they will spend it on development. If you give them more money, they will spend it on development. And if you give them more money, they will spend it on development. So forcing them to sit down and say, you know, somebody might actually like to buy this product at some point. And how would I sell it to them is usually a foreign concept to most companies. In fact, we've got a few graduating members of previous Launch Lane courses here. Thank you for coming. And they, in fact, I think one of them is about to just launched their product globally online.
We're doing pre-orders. We'll be launching in January. So.
Yep.
What's the name of the company?
It's going to be very hot ready. Hippiesips.com.
There we go. There we go. See, I've taught him something. Sorry. Yeah, so I've told everybody that nothing else. The one thing I always say is make an ask. So there's your ask. But this year we have 8 new companies. I'm going to briefly, they'll be introduced to you in a couple minutes or in a second. They're going to be introduced to you through a video. So each of them has done a 1-minute video talking about their company and what they're about. And we're going to play that first. And then from there, we will have a bit of a chat and see what's going on with them and see what they've learned in the last year and see where they hope to go in the future. So thank you again for all of you for attending. And without further ado, why don't we jump in and see some of these videos.
Hi, my name is Anjali, and I'm representing Clinicor, a digital health company that aims to ensure that heart failure patients are on the right medications. As an MD MBA student, my passion for this problem stems from experiences working in the hospital with heart failure patients. Heart failure is a huge problem. It is the #1 diagnosis in elderly hospitalized patients and costs the nation more than $70 billion per year. There's been an incredible amount of research done to develop blockbuster drugs that are collectively known as guideline-directed medical therapy, or GDMT. This 4-drug regimen requires close monitoring and dose adjustments every 2 weeks until a goal is achieved. These treatments are incredibly effective, and patients who achieve this goal have a 70% readmission reduction rate. However, titrating these drugs is a time and labor-intensive process that requires frequent medication changes and monitoring for adverse effects. The landmark CHAMP-HF trial showed that only 1% of patients are on appropriate therapy. And I'm going to say that one more time. Despite knowing and having the right treatments, only 1% of patients are on them. That's where our solution comes in. We're building a digital prescription-only GDMT clinic to optimize heart failure patient therapy. Essentially, we're creating a software that increases a cardiologist's reach to be able to manage medications they didn't have time to before. Our software will track our patient's symptoms at home and then suggest medication adjustments for a nurse or pharmacist to implement under the direction of a cardiologist. This way, patients will be at home on optimal medication instead of struggling to breathe in the hospital. Penn Cardiology and the Penn Center for Innovation are interested in a pilot study, and we're currently looking for a CEO and other members to create a leadership team. If interested, please contact me. Thank you.
Good evening, everyone. First off, thank you for your interest, your support, and your time in attending tonight. My name is Andre Diamond, and I'm the CEO and founder of Gray Oncology Solutions. So what we do at Gray is we provide software that allows a cancer center to optimize the way that a patient moves through their cancer treatment. And specifically, I'm referring to the logistics of how they move through their treatment, rather than the clinical decision support side. So often cancer centers are relatively siloed units where you have chemotherapy, radiation therapy, and surgery operating semi-independently of one another, even though they're connected by the constant being the patient. So we provide a platform that automates and optimizes that entire process from start to finish, ensuring all of the resources are being used as efficiently as possible. We can be as transparent as possible with the patient regarding their appointments, and ensuring that the patients are being treated as quickly as possible. We're currently deployed in a number of centers in Canada, and we're looking for innovative centers both across other provinces in Canada and the United States, looking to deploy as a pilot partner. Thank you very much.
Hi, I'm Martina Janikova, a CEO and founder of Lara Health. There are over 40 new reimbursements that pay for care provided virtually, yet majority of doctors only see patients face-to-face or during a video chat. Lara Health has built a turnkey solution that makes it easy to adopt virtual care tools in a medical practice by leveraging automation and AI to maximize physician revenue. With Lara Health, a doctor can add $500,000 a year in new revenue and actually cut 30% of the admin work they usually do. We only launched this year, but we've been signing new contracts and customers every month, seeing a zero churn to date. And last month, we passed $11,000 in monthly recurring revenue. We also recently signed a distribution agreement to access 2,700 physicians to use Lara Health. We are raising $2 million to fuel our future growth.
If you've gone to the dentist, even for just a cleaning, you might have seen that we can create a model of your mouth in 3D in seconds. 3D technology is being used in dentistry every day around the world. Dental schools alone spend more than $350,000 per graduating class purely on 3D supplemental software that fails to engage students, is underutilized, and does not improve learning outcomes. I know because I was a dental student. My name is Jules Mann. I'm now a practicing dentist, and for the past 5 years, I have heard my community asking for better, to learn better, and to communicate better with our patients, which is why we built Modal, the 3D communication platform for learning and teaching and sharing. Modal accomplishes this by utilizing cloud-based 3D modeling technology, ensuring that our users' content is accessible anytime, anywhere, and on any device. We provide 3D education material, such as what you're seeing here, with an atlas of images verified by dental professionals. And most importantly, we allow users to create their own content from our library of 3D images, whether that is study material, staff training, or a lecture for the classroom, such as you're seeing here. It could even be patient education, allowing users to upload their own 3D images. Modal supports students before they're even in school, enabling them to subscribe to a product that they will utilize throughout their career, not just as a dental student, but as a dentist. The future of dentistry is in 3D. Thank you so much.
1 in 4 people will have a stroke, but the damage can be minimized if it is detected in time. Hi, my name is Eric Corkill, CEO of Neuralert Technologies. Already designated by the FDA as a breakthrough device, Neuralert is the first non-invasive real-time stroke monitor that will save hundreds of millions of people from either death or severe disability. Neuroalert automates stroke detection using lightweight, non-invasive wristbands that constantly monitor for stroke symptoms. Now, these bands send their data to a patented algorithm that is constantly looking for stroke symptoms. And when a stroke does occur, the system automatically generates an alert so help can be sped to the victim. We're in the process of raising a $1.5 million seed round so we can complete clinical testing and be granted a license by the FDA. Our expert team of neurologists, PhDs, and business executives want Neuroalert bands on anybody who has a risk of stroke and worn in the hospital, in the office, or in the home. Please help us end the devastation that is caused when a stroke is not detected in time. Thank you.
Hi, I'm Connor, CEO of Opal HTM. You and I are truly fortunate to live in an era of high-tech healthcare. Visit any hospital today and you'll find it brimming with cutting-edge technology. There are devices to help diagnose, treat, comfort, monitor, and so much more. But it's possible to have too much of a good thing. See, every year hospitals in the US spend $32 billion on medical equipment and upkeep, but those devices end up sitting idle 58% of the time. And on top of that, each device is rigorously maintained as if it were used around the clock. These inefficiencies drain precious healthcare resources, and they stem from one core obstacle. Hospitals have no reliable way to track how, or even if, their equipment is being utilized. That's where Opal HDM comes in. Our patented sensor modules interface directly with medical devices to track where, when, and how often equipment is used. Think about it like the odometer that tracks mileage in your car. This simple idea makes a huge impact because we can analyze this usage data to uncover patterns and pinpoint inefficiencies. With Opal HTM, our customers can safely reduce inventories by 25% and cut maintenance workloads in half, putting millions of dollars back into their budgets and reclaiming staff time that can be directed towards improving patient care. All told, this technology is poised to make a $9.2 billion impact. Right now, Opal HTM is at an exciting inflection point, and we're seeking passionate collaborators. So if you're an innovator or investor, or if you're in healthcare and you'd like to see this technology in your health system, then get in touch and join us in transforming healthcare technology management for the better. Thank you.
Of the 36 million Americans hospitalized each year, one of the leading causes of preventable death are venous clots, or clots that develop in the deep veins of the body. These clots have a death rate as high as 30% and carry a cost burden of over $12 billion annually. Patients at highest risk are those who have just undergone surgery, like a joint replacement, with most clots occurring after leaving the hospital. To decrease hospital stays and costly readmissions, post-op care must evolve to address these complications in the outpatient setting. I'm Dr. Erica Dillard, founder and CEO of PopCheck Technologies, where our mission is to make recovery for all patients stress-free. And we will do this through our AI-empowered remote monitoring technology. Our device will not only more effectively prevent clots, but is capable of identifying abnormal biomarker patterns concerning for clots. Through a remote monitoring platform, the device communicates real-time changes in patient risk so the healthcare team can make a more informed decision about patient management. This encourages earlier diagnosis and treatment while offering providers an opportunity for additional revenue. To learn more, please visit us at popchecktechnologies.com. Thank you.
We've all heard of the 4 vital signs: pulse, respiratory rate, body temperature, and body pressure. Today, we'll be unveiling the 5th, the vital sign for well-being by Vital Start. Our initial focus is on maternal mental health, an area that's really close to my heart and one with clear gaps. We may have heard of someone with a tough pregnancy and postpartum, but did you know close to 65,000 near-death experiences occur every year, 1/3 of which is attributed to mental health? I know because I myself have been through postpartum depression. Hi everyone, I'm Kritika Parmeshwaran, a Wharton alum with deep expertise across technology and business, and I am the founder of Vital Start Health.
Hi, I'm John Chu, one of the co-founders as well of Vital Start Health. I'm a neonatologist and associate professor of clinical pediatrics at the University of Pennsylvania. We have developed the first personalized telemedicine platform for maternal health using virtual reality. We provide coaching and psychotherapy for mothers and families across the pregnancy and postpartum continuum. Our system is based on sound clinical management best practices, and we have structured our services and business model so that we can deliver services and be equitable to all.
We are a University of Pennsylvania company supported by the University Science Center, Microsoft for Startups, the Comcast Connect program, and we are excited to go after this $18 billion opportunity. Join us.
All right, so most people who are listening to this online, you will not be able to see me. I will be on screen, but you should be able to see the rest of the company. So, sorry, this is big noises. When we first started this whole journey together about a year ago, I remember asking each of you who I was, and the answer from each one of you was none of you knew who I was, none of you knew anything about me, and none of you knew anything about the history of Launch Lane. And so it was depressing, but it seemed like you know the only thing that made you guys want to join this program was the money that we give you, the investment. And so I'm going to ask our question first, obviously. So, you're at the end of this program, and looking back on this journey, who here still thinks that the money was the points, or the money was the most important part of this program? Anyone? Except for Andre?
It's always about the money.
So then, what was it about? So, maybe I'll leave it as an open question. What was it about? Now that you've gone through this program, what did you find that was the value for you?
I guess I'll start. For me, it was really the network and the bond that we created with each other. You guys know, for me, I always mention this, but I felt like the one who was kind of the earliest in the process. And so when I came into the program, I was a little bit, a little nervous about really jumping in there and trying to start at the point, like you said. We often think about the development and technology part of it, but not necessarily really thinking about commercialization at an early stage. And so when I came in, I was still very much involved in thinking about technology, which I still am. But I think being around these guys really helped push me into thinking about questions that I never really asked myself before. And also some of them having experience in companies before. That really, really helped Eric. He knows it. He knows a lot. But yeah, I think just that that network with each other, and also the network of the university sciences. And there's a lot of opportunities that have come from that, just from being involved in Launch Lane. So.
Have you gotten any money recently?
I have.
And did we have anything to do with that?
You did.
Anyway, next question. So, Eric?
So Eric, you are like a grumpy old professor who loves her students. You push people, you won't tolerate laziness and lackadaisical behavior. And at the end of the day, as a CEO, you make us better at our job.
That was the right answer, so we'll go on the next one.
For me, I want to say from Vital Start, I think the credibility that the University Science Center brought, propelled us to raise a friends and family round, to get into Microsoft for startups, and really go after that commercialization. Because I think if we were going a little bit into just the clinical validation or development, and I think that pushed us. You and Eamon, I think I written that in the exit interview as well. I sincerely do feel that we learned a lot. We thought we would be a little lost. We're sort of doing the same sorts of things many times over at Healthline. And I think we broke through that. It was a breakthrough moment for us to push beyond. And now we've raised over $165,000, and I'm looking to raise another 1.5 million. So I would say I attribute a lot of that to science.
Okay, right. The same question. Yes. Okay. So, sorry. Yeah, I'm trying to think of the best way to address this without going on a complete tangent, as everybody knows I'm off to do. I was introduced to Launch Lane through Local Accelerator, and specifically because we're looking at the States as a market. And initially was going to kind of join it as a boot camp and more of sort of like an 8-hour workshop type deal, but ended up, one thing led to another, and ended up joining the accelerator. And was a bit skeptical at first, because of like who Aaron was and how aggressively he was pitching it to me, and secondly, just because of the time commitment. But it ended up being a tremendous use of time and kind of a highlight of my week, both on an educational sense and sort of the learnings that we had, and then just on an emotional sense. It's like it was one of those rare occurrences where you get to kind of relax with friends while also working, which isn't something you often get, particularly as a CEO. So that was a major thing I got out of this, and was more than I expected at the start. So not sure if I went outside the box on the question there, but.
Yep, no, thank you. How about you, Jules?
I want to say the friends, but I feel like that's the common answer here. So I'll branch out a little more. I think that our story was really common in the startup world of being someone who has no experience in business, but a really cool idea and just not knowing about what to do with it and where to go next. So we did one accelerator, and we still felt like we didn't have the business experience to really take this idea to the next level. And so getting to be a part of an accelerator that had people that have gone to business school, that have, doesn't even matter who've gone to business school, you have the experience with the business to answer questions, to make introductions, and to help you when you're feeling stuck. It was just what we needed, and we're really grateful for that opportunity.
Thank you. How about you, Martina? Our second, Martina is our other international company.
Hi. Well, for me, it was getting a tough co-pilot, I guess. I know that lots of my colleagues didn't have the experience I did. I worked for a startup before. I launched a remote patient monitoring. I built it and designed, I commercialized it. I was working from past mistakes and experience, but I wanted to go fast. And we applied to a few accelerators. We got offers from a few accelerators. What really attracted me to Launch Lane was this is a pure healthcare accelerator, so I knew you guys will have the expertise. What really convinced me I wanted to work with Aaron was the email we got for the last page where he really showed you a tough luck guy. He tells you as it is. I'm pretty sure you said something. This is how you need to prepare and be on time. And if you can get your together, you should not be applying against this Launch Lane program to begin with. I said, I like this guy. I was like, wow, he's not sugarcoating. He doesn't sugarcoat, but boy, can I tell you, when we had a bit of a hiccup, and I said, Aaron, I have a situation. He was like, that's what you do, Martina, and you can do it. And blank, 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 go for it. And we did, and he was right. And you know, we chose well because not only have a great team and we became fantastic friends, we had co-pilots.
I think for me, as a student, I just kind of fell into this. I was in med school, kind of saw this as a problem and wanted to, really actually create a solution to fix it, but I had no idea how to go about it. And I think the accelerator has been super helpful. I think mainly because of mentorship. I think mentorship from Aaron, from Eamon, just all the resources that have been compiled, and then the mentorship that you've got from your peers. And I think this whole process can be very unstructured in some ways, and so just having that like weekly check-in point where someone is keeping you accountable is really, really helpful.
Connor.
Yeah, so you're right. It's not all about the money. There's also a week that we got to sample fine Italian wines. So that's definitely a highlight. But no, I'll stick with
the CEO sitting right behind.
I didn't get any wine.
Your bottles are sitting in my office, Andre, so there's a ride here. You gotta come to the US.
I'll stick with the calm answer, as Jules put it. I'll say it's the camaraderie. It's the founders around me. You're starting off this venture, and you have a temporarily, but still a small company, and so you don't have someone to kind of to talk things through with. And I'm sure everyone here can identify with. Sometimes you beat yourself up so much over the downs, and you really kind of the highs kind of fall off. And here, I come in a week and I have a nice thing, and everyone gives me applause. I'm like, oh, all right, that's nice. And then I have a down week, and I'm like, oh, I've been through that too. This is how you pick yourself up. This is how you next step. So the camaraderie has been incredible, and honestly, and the knowledge too. It's funny, Andre, you made that comment about your wants to go on tangents, and I remember the second week I was like, "Hey, Andre, guys, won't shut up." I want to hear what Eamon and Aaron have to say, and and by the fifth month, it's honestly sooner than that, Andre. But I'm like, Andre starts to say something, and I'm all ears. So I'm like, oh, this guy has been through a lot, and so just all the knowledge that's in this cohort, being able to tap into that has just been incredible.
Great, John. Anything you want to add to this, or are you good?
I would agree with everybody, and I think amongst everybody, I've been just very fortunate to be to have Kurthika as sort of my partner in this, and I probably have had the most scheduling issues amongst everybody, but despite that, I think every time I'm able to join the meetings, it's been so inspirational. I learned so much from everybody at the meetings, and I really appreciate the opportunity to kind of look at what other other people are doing and what other members are doing, and sort of the barriers that you've been able to overcome, and then learn from that as well. And I've seen VitalStart, and from VitalStart standpoint, I really appreciate how being in this program has taken VitalStart from a mainly a clinical trial type of a mentality to a business mentality and operationals mentality. So and it's really showed the value of that. So I appreciate it. Thank you so much.
I need to get you a spare bottle of wine because that's an excellent segue. So what have you guys accomplished in this year? So, you came in here with whatever aspirations you had, and every one of you in one way or another sort of indicated that you've taken a little bit of a left turn based on where you started in terms of where you thought you were going to go and where you ended up. So maybe I'll start with Andre, because I think Andre was the first sort of exciting events to occur, right? When he joined us, he was making some big changes in the company, or doing some big things in this company. So what are some things that maybe you want to highlight about your growth this year?
Yeah, there's been a ton of them, like just both good and bad. So I guess we'll highlight the good. First off, kind of, we were right in the middle of closing a round when we entered Launch Lane, and successfully closed that round. And a big part of that certainly Launch Lane helped with, in terms of just there were challenges in closing the round, as I'm sure there always are, and being able to talk through those on a weekly basis. And then we sort of saw our first deployment, as you heard in our quick video. We're a relatively disruptive enterprise software that sells directly to hospitals, which have purchasing committees and IT teams and legal teams the size of our company or bigger. So getting through that, even at an early stage rather, is very difficult. So there were plenty of good discussions surrounding that topic, and sort of just how to handle those conversations, how to handle the emotions that come with it, and sort of getting into the weeds, as I like to say, rather than sort of just some of the quick hits that you can learn online or through just quick sound bites.
How about you, Erica?
So there are a couple of things I think that over the past 9 months have really stuck out to me. One of them, I think, is really just learning how I can be a CEO. A couple of people have mentioned about coming from a purely medical background. It's the same thing for me. And just learning what it takes to move into that role as a business person without any business background whatsoever, not even so much as a business class. And so really taking on that responsibility, you guys really did such a great job in helping us focus on how to do those things that are most vital in the stage of vital in the stage that we're at. And so I think that was one of the most important things for me. I was able to do the program build my team a little bit more. So, coming in again, it was just me. And I gained some really awesome advisors through Launch Lane, who are advisors for the company now. But I also learned how to ask appropriate questions for where I was at the stage of my company to gauge whether or not someone should be involved in the company or not. I think that was probably one of the biggest things for me too, because there's a lot of people that have a lot of knowledge base, but whether or not they're a good fit and are actually going to help out your company where you are and get to the next level is a different story. So I think learning how to ask those questions and getting the right people surrounding you for the milestones that you're trying to meet are the most important things. We also work on our prototype as well. So we're gearing up for an animal experiment to do a feasibility study in the next, well, actually now, I shouldn't say next, but actually right now. So I've been working on a prototype that, again, those people that I have involved in the company to do that stage, where I really have to think about those questions, like I said, that guys help me, formulate.
One of the other things I don't want you to forget is you were terrified of making mistakes when you got here.
For me?
Yeah, you. And your confidence in your ability to make decisions and realize, that it's okay to make mistakes, or how to make decisions. Doing that are all, something that I've been really proud of your growth in. So, how about you, Eric?
Probably have to just divide it into product, regulation, and money. product. We now have basically working prototypes of the devices. Our algorithm was fine-tuned in the second clinical study in Penn. Phenomenal results that we're very pleased with, so that's great. Regulatory path, getting FDA designation as breakthrough was wonderful, but we just submitted our pre-sub meeting request. We'll have that in January, so I now have a clear path of what our regulatory process is going to be in money, thanks to you, thanks to Eamon, thanks to this group. Fine-tuning the message, fine-tuning the ask. Been able to raise $400,000 in the last 30 days. So,
and this is, I think, Eric's 7th company. So, what he's doing.
A lot of gray hair.
In fact, there's some people here tonight that were like, "Yeah, I knew Eric like many years ago at SMS, and I worked with him here, and I worked with there." So, yeah, he's been around in this game for a while. It's nice to see that he's still at it. But that's one of the things about entrepreneurship, right? It's in your blood. You can't not do it. It's who you are. Currently, same question. Progress.
Yeah, I think I like the way you unpackaged it, Eric, and I think I do a similar sort of a thing. So for us, it all began because, like John was mentioning, we were very clinically focused, and it was all about, hey, you're trying to use virtual reality for psychotherapy. It's not tested at all for perinatal health. What can you claim? So we went about doing a really promising feasibility pilot at the NICU, and that showed us that this really had legs, and the VR was visceral. There was, it was going to be working, and we could take this further. So that was a phenomenal experience. But we had to capture that and convert it into a metric towards our milestone, which is commercialization. That's what Eamon and Aaron have been, drilling into us, that everything has to lead to commercialization. Don't do anything otherwise. So we also did the licensing with the NICU, with the Children's Hospital of Philadelphia, which was a phenomenal experience. And I think we had a lot of guidance from Eamon and Aaron on how we should go about it. They had called experts. That was a huge help. And that helped us take this even further, raise the round, get into other accelerators. We also brought on new advisors. Rick Open from Comcast is joining our advisory board. So there is a huge deal because we really want to attract folks who are hands-on, who can help us take this forward. And last but not the least, I think it really has shown us how to go beyond ourselves, delegate, use all the resources you can, but make sure you have that final product that's ready to commercialize, pivot if you need to be. So I'm also doing direct to consumer now, which is not something that we're thinking at all. So things like that, and it's just turned out to be a much more exciting journey because of the focus on commercialization and reaching your goals through that. I think that really has helped in our pitch, in our business plan, and excited to be in this stage that we're in.
Yeah, one of the things that I think we learned a lot. I mean, myself as a clinician, I'm used to sort of doing things on my own and doing things on a team and just kind of taking the bulls by its horn. But what I learned a lot was the use of I guess the importance of time as a commodity, much more important than dollars actually, as well as the value of human capital. How do we leverage the experts around the room, experts in other areas, so that we don't have to learn everything, but we can kind of put things together and manage that. So thank you for that.
Big one. Jules?
Every week at the start of Launch Lane, we would say how we were 5% better that week. So is this like our 100% better now at the end?
Well, how many weeks has it been?
Many weeks.
So 5 times how many weeks it is.
Don't ask me for math right now. So when we started with Launch Lane, we were just a couple of kids at dental school with a cool idea. And we kept being told over and over again that we wouldn't be successful unless we could break out of the pen ecosystem. And so now at the end, I'm really proud to say that we've tripled our user base in the past 5 months, and we are in multiple schools outside of the pen ecosystem. So very grateful for that.
Was it true?
Yeah, it was very true.
Did you believe people, or did you sort of be convinced?
I think I needed to be convinced. but it took a whole team to get us there. So
I was going to say, I don't think I was the one who had to convince you, but I think it was your classmates.
I listened to their advice too.
How about you?
Yes, well, we had very exciting journey since we joined. We interviewed for one of the very few places in Launch Lane a year ago. We had almost working a product, no customers, and you know, a vague idea how this product is going to evolve. And it's December, and we'll be closing the year with about $250,000 in revenue. From one module, we have 4 working modules now. Our objective was to at least double a revenue for the doctors that use Lara Health. And the latest module we added, we are proud to say, hey, with us, we can quadruple your revenue and actually work less. We've done studies with our early customers, and the most exciting part is we have a background in reimbursements. It's obviously very attractive to independent practices who are struggling to keep the lights on, especially because of COVID. But our early studies also showed we are doing terrific things for the patients with our hypertension program. We managed to lower blood pressure by 25 points, which is 10 times the self-monitoring home alone does. And that's just astonishing to the doctors when we show them the results and say, look, this is a big clinic with 500 enrolled patients, and they managed to do that in less than 5 months. 96% patient compliance, where, you know, today there are lots of companies who claim they can do more patient monitoring and patient engagement. We actually have the data now to show we can do it with, you know, fantastic results. So yeah, it's been a great journey. Thank you for having us. Of course.
Yeah, I think the past year has been, you know, lots of ups and downs, and I think some of the things that we've been able to accomplish, we actually have like a working prototype of our product. We were, you know, able to, we talked with, you know, people at Penn. We were able to talk with the Penn Center for Innovation as well as Penn Cardiology and get some of them on board as advisors. And they have like an interest to actually run like a study for the pilot. I think there have also been some downs. So there, you know, we similar to what Erica said, I think our team, you know, had some internal issues, and I think Erin and Eamon were really instrumental in helping to work through that and also introduce me to other people. And so I think, you know, it has been like a very longitudinal process, but I'm happy to sort of say that, you know, I have a much better structure for thinking through these things and actually thinking about like next steps.
So I'm going to pick on you a little bit longer because I think you had a harder go of some things. Not to say that anybody was, you know, easier really, but you had to make a big decision which other people didn't have to make, which was you made the decision that you weren't going to be CEO of your company.
Yeah.
And that's a huge pivot for a company to make, especially for somebody who's a founder who's built this thing, to realize that there's a different direction that you need to go, and that maybe you're not the one to lead that team to do it is a very, very difficult thing to do. Because most people who start these companies aren't going to think that they're ever not going to be founder, they're ever not launching the founder, they don't want to belong to a company if they're not the founder of.
Yeah.
And I think that, you know, you realize that taking that journey with us to, you know, come to that conclusion for yourself is a huge, difficult thing that you have to do. So I want to recognize that as well. So.
Yeah, we've had you know, progress in a lot of aspects, you know, product, market validation. But if I'm thinking about where Launch Lane has really made the difference, you and Eamon and the rest of our cohort begrudgingly knows my penchant for a nautical metaphor. And I feel like I started this thing out, you know, with know this technology, know that people want it, but we have this little pontoon boat, right? How am I supposed to take this across the Atlantic Ocean? I have this little pontoon. And the lessons and the resources and everything Launch Lane has provided has given us the ability to really build up the company to, you know, to go from just being a technical founder, someone who, you know, knows the tech, but like, how the hell do I get it where it's going? And actually now have the vessel to load that thing up and get it to our customers, make the difference. So I think Launch Lane has made a difference for our execution going forward more than anything.
So, you know, everybody keeps giving Ava and I all this credit. The reality of it is that we don't really do a whole lot. We just put really bright people in a group together and sit back and let you guys fight it out. And yes, I'm joking a little bit, but it's somewhat true, because I think part of the magic of what makes this a useful and valuable ecosystem for you guys is each other. We pick people who we think are not going to compete with one another. We pick people who are at different stages. Erica, you mentioned that you were the youngest in terms of progress, right? And Eric and Andre were sort of, you know, the farthest along when they got here. And Anjali was on the earlier side, and the rest were sort of in the middle, and there's just different varying stages, and that's not by accident. Part of what we do is we like to take companies that are further along because they can answer questions for the companies that are younger. We like to take companies who are younger because it gives them the opportunity to learn from the folks, you know, knowing that it advances them quick, right? You get where you need to go faster because you have big brothers and sisters who are looking out for you. And, you know, you sort of alluded to this to some degree about that the cohort have become your friends. These are people that you're going to keep in touch with. These are people that you're going to follow up with. These are people that you're going to call when you have a problem. And one of the designs of this whole endeavor is to say, look, being a startup is a sort of, you've got to be sort of a strange person to want to do stuff, right? Because Martina, I don't know exactly what you did before, but you know, you had a pretty serious day job, right? You know, a number of you had pretty serious day jobs before you got here, and in every cohort it's the case. And you said, you know what, I'm leaving that to do something that has probably 90% chance of it, right? Something's wrong. But the good news is that everybody sitting here today has something wrong with them. They have the same something wrong with them. And I think people undervalue, when you get to the program, you don't realize this, but you undervalue the strength of having other people who are just as wrong as you are in a room together that you can trust, that you can talk to, that you can rely on, that you can follow up with. And you know, the previous Launch Lane class is still coming here. Actually, more of them would have been here if they could have been, because they feel the camaraderie with each other. They still check in with each other. They're still working with each other all the time. And Jesse's a mentor in the other room right now. But that's part of this. So this is a long preamble to say, what are the things that you'd like to say to your classmates? What are the things that, you know, what are the things that you realize that having that ecosystem may have changed or made your life better for having that in your life before? You may not have realized you needed it, but now that you've got it, it's something that do you still need it? Do you stick around with it, or you know, you kind of done with it? You don't want to talk to anybody. She's starting this side.
Yeah, all right. As long as we talk to our classmates, Andre, I apologize. I never thought that about you. Love you, man.
Targeted.
Yeah. Yeah, no, I'd love to keep in touch with you guys. I got so, and I've spoken tonight about how much I've gotten out of this. But you know, tonight's the first night we've all met each other in person. And I can honestly say it didn't feel that way. You all felt so familiar already. So I'll hand it over to Anjali.
Yeah, I completely agree with that sentiment. And I think it's just really nice to have like a safe space where you can talk about things. Like there were times when I was going through things with the company that I wasn't really discussing with other people, but I felt like I could discuss it within Launch Lane. And I think whenever you're starting something new, like there are going to be huge challenges, and it's like easier to have a community that can understand those challenges.
Yeah, we didn't want to stop our weekly meeting.
Martina basically told us we're meeting every week. That was last week.
That's right. Oh, that was my, upper spring evening. I was not giving that one. It's true. And I started the company right when the pandemic hit. And it's a lonely job. I have a fantastic co-founder, but he's a technical co-founder. He codes. He's not the social, butterfly. And I was working from home. I was looking forward to evenings with 3 kids. I was looking forward to these evenings where you can, roll your team and complain and get the balls and run ideas and help others too, because it's exciting to hear that other people are building something in healthcare which we all care about very much.
I'll just say that I hope that
I'm gonna miss your Cheshire grin, I have to say.
Yeah.
When you talk about Julie, she has that very distinctive grin.
I just hope that the chats of our Zoom calls are never publicized.
People keep asking me if they can record those sessions, and I keep saying, no, you may not record those sessions. You're exactly the reason why.
Especially the private chats, whatever private conversations ever happen there. But I'll say also, on this note of something, you happy to be crazy or you happy to be willing to take that leap. It can be a really lonely world of not knowing, of being surrounded by people who aren't taking that leap and then telling you why would you ever imagine this would be possible? To be in a room full of people who not only think it's possible, but have done it and have come out the other side, that's invaluable. And that is the inspiration, I think, for the next few years for our team as well.
Well, one of the things that I remember a conversation with you, since you just said this, we should, private conversations, I shouldn't share, I'm going to share one. Which is, no, you're welcome. You know me long enough, it's just coming. You are, you're a dental student, you put how many years of your life to get where you are right now, right? And I asked you, would you give up dentistry to stay with your company? And your answer was absolutely. Like, this is who you are, this is what you want to do. And so many people, go through life with not feeling fulfilled, not feeling like they're doing what they want to do. And really, for you, I don't know, for the first time, but probably one of the first times you felt like you had a place of belonging and that you belonged with these people. This was your family, these are your friends. Even though you never met them, you've never done anything with them, you felt a kinship with them because they understood. Right? They understood that you put in all these years for an Ivy League education and you willing to give it all away just to start from.
Just throw it away.
Yep. How about you, Andre?
Yeah, I mean, it feels bad to say I'll take a little bit of what everybody else said, but to not sound like a broken record, both with what Martina and Jules said about sort of it's lonely up here, and especially in my world, my founder, kind of similar to Martina, is the technical type, so not really the type to be a thought wall back and forth constantly with the more business side of things or the more political side of things. And that's sort of on top of the fact that he's incredibly busy with the deployments we have. So that sort of compounds the issue of not having the time to talk shop. So having a group of people to be able to do that with has been inspirational, both in its existence and in everything Jules was saying about just a collective body of people who are doing the same thing that you were doing. Makes the hard times easier. So I guess that's in a very roundabout way to the initial question, which, coming back to it, yes, I'd love to continue talking with these people if they want to continue talking with me, which, as Connor said, I mean, that might be questionable.
I didn't mean it.
So, this is how it has been almost every week, and we just have so much fun, and it's great that everyone's so helpful. Just have to write an email, Eric, how do you do PR? Eric sends a whole paragraph and things. So it's just, everything was so easy, felt like, and the biggest thing for me was no one really showed any ego or anything. We poke holes at each other's one-pagers and pitches. I remember falling flat the first time I pitched. But the thing is, it was just it was an environment where you knew that you could trust them and that you could learn from them, and they were there for you. So I think that was just a huge takeaway, and it's just unbelievably cool. That's really great. Thank you.
John, anything to add?
I just want to echo what everybody said, and I think in all honesty, although I'm co-founder of the VitalStart, I'm not CEO Kurthika, right? And I think I had came into this thinking that a group like this is really for sort of CEOs in business, and I'm the clinical person, and so, but what I've learned is that, boy, there's so much value in myself being a part of this, and I really and how great it is. And one of the things I think Kurthika and I learned was how to work together in a way that's really kind of takes into account some of our roles, as well as Kurthika, when she's learned things, she's always emailing me and just kind of keeping me up to date on things and helping me understand what's going on. So it was a really good learning piece for me, and I'd love to continue staying in touch with everybody, and perhaps maybe talk to the other co-founders who didn't have that as much experience as I did, and just kind of it's really inspirational. So thanks.
John, it was interesting to watch you as well, because when you showed up, you were pretty tightly buttoned up, and you started, you showed up as a clinician and you ended as a founder. And I think, by the end, you really started, fell into it and started to feel comfortable in your skin, and that was nice to watch. So, know that we were noticing that. I'm actually going to skip over Erica. I'm going to go to Erica next, because I'm going to come back to Eric for a reason.
Well, yes, I will want to talk to you guys more. No, I think that's what I started off with saying, is that I think our phone work was matched really well. So kudos to everyone who put in time to come up with this group, because just the amount of knowledge here really put me into the next level with the company. And I don't think that I would have been, ready to face, some of the challenges that I faced during this time and reach some of the milestones that I did without this group. So definitely we'll be keeping in touch with you guys, but also just with, who's involved with Launch Lane, even you, Troy. I mean, the whole group, everyone who put so much time into marketing what we were doing as well, because that's not my strong point. I mean, I try to stay away from social media.
They're in the room. You can say thank you. They're here.
Yeah, I did. I sent individual emails to everyone. Yes. Wonderful job of just getting the word out there about us, and I was just always sweet. I didn't have to make anything on my own, because everybody already took it and rolled with it. So, yeah, I mean, want to see, Troy, he's the one that's the go-to-market. Oh, that's cute. Your go-to-market strategy is crumbling again. Try again. But I needed that. Those are things that I need, and those are the conversations that I will need moving forward. So really happy to have been a part of it and relationships.
Troy's an engineer, he's not good at finesse, so yeah. So I'm coming back to Eric last, because Eric's probably unaware of the fact that we're aware of the fact that Eric has probably been the resident OG here. He's been spending a lot of time with each of these guys behind our backs and meeting with them and providing help and being a mentor to so many of the teams this year. And so I wanted to say thank you, Eric, because I probably didn't know that I do, but we're well aware of that fact, that we appreciate that. But that being said, I want to say thank you. But second, I wanted to end with you and see if you had anything else you wanted to add.
With respect, thank you, and it was a pleasure. I call you a teacher. You don't really teach. You ask questions, and it's a pure Socratic method. And when you don't get the answer that you think addresses the question, you ask again. You ask harder. You ask differently. And it's through the asking of questions and then facilitating the dialogue between the other cohort members that you open up new awareness. So it's a wonderful teaching methodology, very rewarding, and one that actually sticks with you, because you are actually part of the evolving answer that comes out of the question. So it was wonderful.
I don't think he's leaving the cohort. I think he's joining the next one.
It's okay if he wants to stick around, that's fine. Well, thank you for that. And yeah, it's interesting, because we start as I think Jules pointed out, with 5%, 3 to 5% can't progress.
I think he's starting with 2%.
2%. At the beginning it was only 2 anyway, so And I don't know if you guys must have noticed, but every week we would enter into another critical discussion about something you need to discuss, and they never overlapped. And it always came organically from the progress that you guys were making, right? Because as you learned from previous weeks' progress and learned from the mistakes, the discussions that happened there, then you didn't really need to address those anymore. So you bring new things up when you're talking about your progress and that would bring up organically new things that you wanted to talk about. And it's sort of just, each week it was something new, it was something different, it was something useful. And you ended up sort of going through a whole curriculum that I could have written, but it was better this way, because to Eric's point, doing it organically, being part of it, you internalize it, becomes more your decision making, you take more interest in it, and then walk away remembering the answers. So I appreciate you guys recognizing that. So we're almost out of time here, so I'm just gonna ask each of you one last thing, which is, what's that? I am out of time. We started late, so I knew that I had a minute or two extra. Sorry, Jerry, and sorry, Tiffany. Hopefully I don't get fired here. So Erica, if you had an ask, what's your ask? You've got a group of people here. They could be anybody, they could be helpful, they could be interested. What's your ask?
I am interested, just considering the technology that I have, is really learning or creating partnerships with companies that can complement with what we're doing. I think that's really key. I mean, there's not a lot of medical device, companies here. Like Eric and I both have medical device technology, but also a digital component. And I think kind of moving forward, and where healthcare is going, where it's inevitably going to go, partnering with companies that make what we're doing on the medical device front. And I think the other thing is, like Andre said, money is important as well. So we're doing a friends and family round as well right now. Perfect was really helpful in kind of like getting me up to speed on how she went about doing that. And so we're jumping into that for the next couple of months, and then moving into getting some larger investment as well, because we're finishing up with a few milestones that I think are really going to put us in a better standing through the help of Launch Lane. We've been able to do that. So definitely looking for investors, people who are interested and passionate about what we're doing, or people who just think it's cool, like whatever.
Yeah, well,
I think that's
I was gonna say, hopefully when this is over, then, you walk around and you talk to some of the people in the group.
Yeah,
Say,
yeah.
is there a few that perhaps may be able to talk to you a little bit more about your product from that perspective? Pointing at Stevens, I think, and there's there are others as well. How about you, Eric?
1.2 billion. That's the number of people living today that will have a stroke. And if we can detect it faster, we can save them. So I'm looking for $1.5 million to get us commercialization. Help us do that.
Right. Pretty good.
Wow, that was really good.
Yeah.
So for me as well, so let me start the other way. More than money, what we're looking for right now at Vital Start is to grow our team. And as part of our team, we're also working with mental health practitioners, coaches, psychologists, patient scientists. We want to involve all of them as we grow our product. So that's one thing, the sales, the product side as well. And the other piece, of course, is the funding to commercialize and really go for that full launch with a full-fledged team. And the VR psychotherapy platform completed, like in Feb next year. I need $1.5 million to take this and really capture the era we are in, FinTech meeting, mental health meeting, the needs of moms everywhere. So want to impact 1 million mothers in the next 10 years. That's the goal for Vital Start, and want to take it first to US and then global. So do join us.
Andre?
Yeah, mostly sort of I alluded to it in a couple of my earlier answers and the video. We're looking for health systems that are innovative and looking for digital health solutions within oncology. We realize it's a very, very disruptive platform. So that's why sort of it's a double-edged sword, and we're looking to pilot it in American centers and Canadian centers, of course, but specifically for our first American pilot. So that's kind of very, very frank, very, very blunt, but that's what we're looking to do. So any conversations with anyone who likes what we're doing or kind of has that mandate, always happy to have a conversation.
And we are setting up a laptop with Andre on a desk out there. So
yeah, I'm going to be a little desk. I can't move, but I'll be a desk. So feel free to stop by.
Please come to his desk, and his visage will speak with you. Jules.
I'm next to you, Andre, so we can chat virtually.
Perfect.
The EdTech space is bigger than ever. We actually do have institutions that are beating down our door that want to utilize our product in the classroom with their students, with their professionals. We need funding to support that growth and support our team in delivering our product to them. Keep it short and sweet, but I'd love to talk to you about that, so come by.
All right. Yeah.
We are looking for 2 million in a C round. As I mentioned before, we signed a partnership with a solution that already has 2,700 physicians who are open to use Lara Health, remote patient monitoring, and just trained the sales team. They will be going out there in January, so we have to build our team. We need more salespeople, account managers, and customer support to handle it. We already have customers that we secured ourselves, and we are close to the second partnership with a bigger partner. So we're ready to grow and need to pay people who will break their revenues in.
Right.
If you know someone who's like interested in joining a startup and would like to be a CEO and ideally has experience with digital health, please send them my way.
I'll quit my job and come work for you.
Yeah, so to end this thing on a nautical metaphor, I went on to boat, now I got my ship, but I need my crew. And so, not only engineers, obviously that's very important, we're open to talking, but if you are in a health system and you want to optimize your healthcare technology management, if you're an investor and you want to make a difference in that space, come on, join the Opal HTM crew. We got plenty around, so thanks.
All right, well, thank you, everyone. I would like to thank the graduating class of 2021, Launch Lane class of 2021, and thank you guys very much. As much as you say that you've helped us, we've helped you. You've helped us. I mean, it's always an honor to be amongst people that keeps us young and keeps us focused on the things that really matter in the startup world and commercialization world. And you remind us of why we do what we do every day. And you make my job the best job in the world every single time we get to spend time together. So I would like to say thank you to each of you for all of that and for all you've done for me personally, especially during COVID when we need this sort of thing. So thank you, everyone, and one last round of applause.